everyone. Good morning. Welcome to the community briefing. We are here once again on what day is it? October 8th, 19th, 2023 on a Thursday at 11 a.m. So we're so happy for those that are joining us. And for those of you that are on Facebook, welcome. And those of you that may be viewing this at a later time, welcome to you as well. I am Crystal Mitchell. I'm the co-director of Recycling Black Dollars. The inspiration behind the community briefing during the pandemic, I just wanted to make sure that we got all the information that we needed to get so that we could make the right decisions and to be able to stay in business during that critical time. But just that it has kind of grown its own wings, and now it has a platform that will inform, inspire, introduce you to our leaders and stakeholders that are making decisions on our behalf. Also letting you know who they are so that you can too support and reach out to them. This platform is powered and sponsored by Recycling Black Dollars and the Black BBA, the Black Business Association, and monetarily sponsored by Southern California Edison, SoCal Gas, Wells Fargo, and PCR, and Los Angeles LDC. And we are very appreciative. And anyone else that want to give to us, we will appreciate that too. But this is your platform. This is your network. We want you to support in the essence of Recycling Black Dollars. Us supporting each other will help us build a better community, working together for a better tomorrow for ourselves and our youth, our young people. So thank you for supporting us. We have a fantastic team. Excuse me, all of a sudden I can't talk. Mr. Stephen Turner, he's our producer. Excuse me. And Ms. Robin Billups and Mr. Gregory Sneed. And today we're being moderated by Ms. Robin. I'm going to turn it over to her. Mr. Gregory is out for the moment. Today he's doing his thing. And so with that, Robin, it's on you.
I'm so glad we got these healthcare folks here today, Crystal. Good day, everybody. Robin Billups with the Billups Group. Exactly. Good day, everybody. It's Robin Billups with the Billups Group. I work with clients who are looking to create strategic plans for their vision and missions of their businesses. But today I'm excited because I'm actually a foundation member of the Dream Team with the Martin Luther King Hospital. And today we have some exciting news for you. These ladies, yes, I can read their bios, but let me just talk about them individually. Diane and Sharon are two women after my own heart. They believe and understand and have committed to our community, to healthcare and the industry. They've had some exceptional jobs. They have exceptional education, but more importantly, they believe in community. They believe in disparities. They believe in finding solutions to those disparities. Diane brings over 30 years of experience in the philanthropic world. She's the president of the MLK Health Foundation. She's been leading that since the inception in 2012, and she'll give you a little bit more information about that. But she's one of those, she's a mover and a shaker, but she doesn't come off like that. She just comes off like a regular sister who done pushed her sleeves up and trying to get something done. And then Sharon is a director of major gifts with the MLK Community Health Foundation. Again, these ladies know how to raise money. They know how to ask for money, and they know how to bring value to the money that's being raised. And so why are they here today? We've had a presentation before from the MLK Community Health Foundation Hospital, but why are they here today? Because we believe that it's critically important for our community to understand the value of this hospital, how it was, why was it built where it was built, how is it staying open, and what can we as community help ensure that it stays open? So I've asked them to come on today and just give us an update and some facts and figures so that we all better understand how to manage our own healthcare, but also too to support this hospital that's there for us. I'm going to turn it over to Diane, and then she's going to work with Sharon. And we ask that you, if you have questions, please put them in the chat box. We're going to get to that eventually. What I've asked Sharon to do, if there's some simple answers that we can provide, meaning links to information that's online or the services that are available, she's going to be taking care of that. But we'd like to get into this because, as I always say, guys, our vote is important. Our vote is critically important. And there's going to be some policy issues coming up and some funding issues coming up related to our healthcare. And these ladies are going to be here to help us understand that better. So Diane, I'm turning it over to you.
All right, thank you. Thank you very much, Robin. Over the course of my time after I began work before the hospital opened in early 2012, I evolved into the chief communications officer for the hospital and health systems, and then a little bit later, government advocacy. And you'll understand how that all works together as you listen to me and as we talk about the challenges that we face right now. I'm going to start with the very present and then go back a little bit to our founding as a reminder of why and how we were founded, and then bring us back to the present and the services and the challenges that we have. We not only serve our community, but we need you very much. It's very much of a collaborative partnership. The very, very present is that I'm happy to share that we received a visit from the United States Secretary of Health and Human Services, Javier Becerra, 2 weeks ago on a Friday. And that's something called a state visit, because it's a very high level, in this case, agency official from the federal government. These visits are very, very hard to get, and I'm very proud of our community and our hospital for earning it. We were visited by Secretary Becerra as a model to demonstrate, in this case, how our maternal health and health equity, birth equity work was considered a model for the rest of the nation. And that's something that we wanted in the very beginning. We wanted to not just open the doors of a hospital, but to improve the health of the community, which is a much bigger thing, and to become a model for others nationwide. So this visit of Secretary Becerra, this state visit with media outlets, et cetera, was a real affirmation of that ambition that we had early on. Sharon, if you could give us our first slide, please. All of you know something about us, and many of you, if you could go to the second slide, Sharon, thanks. Many of you know a lot about the community, of course, that we serve. None of this will be surprising to you, but our service area spans what we call SPA 6 for the county, and includes on average, about 1.3 million people. Our mixes of population and our demographics are evident, Hispanic and African American, and you probably know the rest of this. I think importantly for our community is also that social determinants part, which very much impacts your education, your housing, your access to jobs, your access to services, very much impacts your health, right? So when people end up in our emergency department, they are not only impacted by perhaps a condition for which they are there, but that condition has evolved out of something that everyone knows quite well, which is the conditions of the community. And we look at that as conditions of structural racism. So as we look at social determinants, we look at this bigger picture. Today, Dr. Elaine Batchelor, who's the CEO of our health system, is a member of the National Academy of Medicine and is on a very small 8-person chosen committee to update a very important report called Unequal Treatment, done 20 years ago, on the effects of racism on health. She was chosen to be among those 8 because she has such a strong voice and because our work has been seen as so successful for how do we track back to 20 years ago and where are we now? So she just came back from Washington in part in an effort to begin the updating of unequal treatment. We have a very strong national spokesperson in her voice. When she was in New York on that same trip, she was with the AHA, Association of Healthcare Association, and she's a member of their policy committee. So when we conclude this, you'll understand why that's an important thing. Sharon, if we could go to the next slide, please. All of you hopefully know about the big day of celebration when we opened. We were accredited, all these things, were now pretty predictable and always for hospitals, not so for us. We were told in advance by the Joint Commission, because of the way that the old hospital closed, that they were going to be very, very, very tough on us, that we should expect a very tough review, that we should expect another 3 months of remediation on all of the points that they found that we would have to remediate before we could open our new state-of-the-art hospital. So the Joint Commission arrived on a Monday morning, and all the admin staff were sent off. We couldn't be in the way of all this work. And on Tuesday evening at around 5 o'clock, I got an excited phone call from Elaine, Dr. Batchelor, and she said, "Come on over, we're celebrating." I said, "What?" And she said, "The Joint Commission team has gathered the entire staff of the hospital together to let us all know that not only have we passed, but we have passed with such flying colors. We have exceeded their expectations so fully that in only 2 days, they are writing us off with no notes." That was a moment of such great pride, and a moment that we all worked, most of them, the hospital people, for a full year to get up to that point. But it was pride for our community. I can remember actually the day standing about 2 months in or so in the beautiful but very empty waiting room of the emergency department with Dr. Casillas, who is still the head of our emergency physicians. And he looks at me and he said, "Well, do you think they'll come?" And I said, "Dr. Casillas, I think they will. I think they will." We were a hospital designed for 25,000 patients each year to come to us through the emergency department. At that time, it was assumed that that was the number that we should expect based on research, but also not such a significant number that we couldn't handle not only the volume itself, but importantly, the financing of it. When our supplemental funding was put together by the state and by the county, the supplemental funding applied to inpatients only. They assumed that we could handle the financial pressures of not being paid for the emergency department patients. And not only was my answer correct to Dr. Casillas, since they did come, but last June, we closed our fiscal year with 112,000, and we think that we are headed to 120,000 this year. We'll talk a little bit more about
Diane,
that.
can you
Yes.
repeat that again? That the hospital was set up for 25,000 annually for the emergency room, and you did how many last year?
112 in the same footprint, as we call it, 29 beds. And by contrast, lower volume emergency departments around us have 2 to 3 times the number of beds. We continue to make investments. So the county, in this partnership, the county that asked us to be a private group to run a public service hospital, very unusual, by the way, said, "What we will do is build this hospital for you, and then you take over." And the original founding partners were the University of California, the private partner, and the county, the public partner. Since we got in, we've made these investments and improved our services. We've made the investments through philanthropy and through operating funds that we generated ourselves and put into capital projects. We have a large labor and delivery suite. That was the first, I'm smiling because that was the first campaign I was asked to undertake. I was told, "You've got 18 months, we need $8 million. We need a larger labor and delivery suite than the county had originally planned." So we went to task on that, and we got our $8 million in those 18 months. And we have a magnificent labor and delivery suite that has private rooms for all of the moms and plenty of space for the teams and the midwives to be in there. We have an MRI scanner, things that other hospitals have, a second TC scanner and a suite, a blood bank. The county thought that we could simply share their blood bank down the road. Hospitals can't run without a blood bank, so we raised money for that too. The endoscopy suite, which allows us to really attend to and care for patients on the spot instead of transferring them, which would often risk their lives in terms of time, to another higher level care hospital. We have what's called an IR suite and a cardiac procedure suite that's opening soon. We raised the money for building an entire medical office building for consultation space. We have a clinic, our third clinic is in there. And also in the MOB, as we call it, is our wound care center. Wound care center has a hyperbaric chamber, which is critical for treating diabetic wounds. It is the only hyperbaric chamber in all of South LA. We have the highest level of state-of-the-art wound care treatment for a condition that, as we know, is prevalent in South LA. Next slide, please. We have also done some programmatic things. We established what's called graduate medical education. We launched that program 2 years ago, but started building it 4 years ago. What this is a residency program. And I didn't understand before I worked in healthcare, a lot of people don't understand that you don't just come out of medical school, you're a doctor, and then go practice. You have to have a residency someplace. And when the scholarships are offered, and very importantly, for people of color in medical schools across the country, if they do not have a residency in a community of color when they graduate, they will not likely end up practicing in communities of color. And this is an important gap. It's a gap because a lot of communities like ours across the nation don't have hospitals that offer residencies. They can't access funds for them. They're usually, like us, smaller community hospitals. But we saw that it was really, really important. We have a gap in our community of 1,500 physicians. If we don't train physicians, and particularly physicians of color, to work in communities like ours, then we're still going to be behind the 8 ball. So we have our second cohort that came in June. By the time we have next June, we'll have a full cohort of 15 internal medicine residents, and we'll continue that cycle, graduating them every year. We raise funds for this. We raise funds because of the way that the federal government has a formula that biases against communities like ours and hospitals like ours to pay these residents. But we think it's an important thing to do. So that's what we do. In this year's cohort, we had every single resident had some connection to South LA. One of our residents grew up as a foster child in South LA and had her foster mother and her foster grandmother there at what we call our white coat ceremony. These are where they do their training rotations. You can see that. Next slide, please, Sharon. We have kept our promise. The county's promise was to build and equip the hospital. The state's promise was to make sure we would always be financially sustainable. And our promise was to offer excellent quality care and state-of-the-art services. This is important. The CMS 5-star rating only achieved by 13% of hospitals in the entire country. And we are the only hospital that serves what is known as a safety net community. The hospitals around us, in the ring around us, the edges of SPA 6, and particularly all of the county hospitals, only 1 or 2 stars. And this is sadly for us kind of normal. It's the expectation. It's why they call them county hospitals or basic services. There has been no aspiration for quality at this level. And our job was to show that you can serve a community with complex conditions and still achieve a 5-star rating. So our goal is to not be the outlier. We don't want to be special. We want hospitals that serve communities like ours to see that they can be a 5-star quality hospital too. Our maternity care has received a lot of recognition, including the recent visit by Secretary Becerra, diabetes care, Joint Commission certification and recognition for, we're right now establishing a diabetes center of excellence, which doesn't exactly mean one physical place. It means a collection of services. And if you are determined to have all of the services needed for the entire range and to perform over a 5-year period at a quality level, then you get the certification for being a diabetes center of excellence. And we're about halfway through that process. We developed a program called Integrated Behavioral Health. And integrated behavioral health meant that when we were receiving patients in the ED and they were presenting with physical conditions like a cardiac arrest, and we took care of that, but we realized there was an underlying problem, right? What caused that cardiac arrest for this relatively young man who was otherwise healthy? And why should we see him 4 or 5 months later back in the ED with the same condition? He had an addiction disorder. We didn't think it made sense at all to only treat the medical condition and not simultaneously engage that patient with an interest and an opportunity for follow-up care. So we created a program that's pretty innovative because other hospitals separate these two things. We placed counselors and psychiatrists in the ED and in the hospital and establish the relationship that would help the patient move over to the outpatient setting and enroll in a program and engage in follow-up care. So that's something that we've done. And then finally here, the Lown Institute. This is a nationally recognized research institute that studies quite a number of things. We were ranked, as you can see, very high in California and the nation for the community investment. There's a way that they establish a formula for how much you spend actually out there on your community. Next, please. Here are all the things that we've done. Some of you know about our community health programs. I believe we might have talked about them at another point in time. But you might not have known that we were very active in the COVID vaccination, not something that we would typically do, but we saw the need and we got out there into housing projects and grocery store parking lots and churches and all kinds of places and delivering a lot of vaccinations. Our fundraising foundation, we're at about 115 million to date. And these are all for the kinds of projects that I've just talked about. It's our job to add value and to pilot things like integrated behavioral health to make sure that our maternity care and services are as robust as they can be. It's not, and I want to emphasize this, it's not the job of the foundation to close the gap in the operating budget every year. That would not be a very sustainable model. Philanthropy cannot year over year over year be the thing that ensures that that gap is closed. That's where a public partner comes in. Philanthropy is the thing that raises us to that 5-star quality rating, is the thing that starts the medical group in the community, is the thing that opens the clinics. We have 3 now throughout South LA. We have a very diverse workforce that we're always proud of. And it's very common that as I'm walking VIPs through, somebody is walking us through the ED or up in a maternity room who grew up in South LA and are a nurse now or a nurse fellow. So that's something we're proud of too. We have ways in which we develop our workforce where you can see here, and we're particularly proud of that as much as the residency program. We want to be responsible for pulling as many young people as they desire into a range of healthcare careers and helping them serve our community and communities like ours. Sharon, if we could move forward. this is what Robin referred to earlier. I thought it would be nice to have a kind of a snapshot of all of this data. We have, this brings us to the challenges you can see under operating income and margin. And a number of hospital beds, you can see over here the various services. These are the most common services for community hospitals. Community hospitals don't typically do things like cardiac surgery. That's called a higher level of tertiary care. But these services are the most common. We don't do pediatrics. That's an important thing to remember, because we do have actually a lot of children that come through the ED. We transfer those children where we see that they need higher level of care. And we do have the capability of treating some acute things that come in with children. But typically we have relationships with the children's hospitals in LA and also in Long Beach. Children are best placed in environments where there are specialties and pediatricians. You see what Robin helped us remember, 112,000 ED visits. And that, I want to, draw a line over to the other reds you see in the other column. In the hospital, our payer mix is very, very high for Medi-Cal. The other important piece of data here is 4% commercial. Most hospitals, and it is by law that if you walk into the ED and you have to be admitted, they have to take you in, right? But they cross-subsidize with commercial insurance. This is an alarmingly low level of commercial insurance, which means we can't cross-subsidize. If you add up the 76, the 9, and the 10, you really have a need from your public partner to do their job, to make sure that as we are keeping our promise, they keep theirs. After the pandemic and the CARE Act that provided kind of a cover for all of the expenses that came up during the CARE Act, the high level of emergency department patients, which we do not get paid for, and the general overall volume of patients we have in the hospital, we now average 165 a day with 131 licensed beds. So that's tough. Inflation, costs of labor, all amount to what you see here. We built up reserves, as you can see, through 2021. We had a healthy reserve coming into the pandemic, plus we had the CARE Acts. But now we are beginning to eat through those reserves. And we have launched a very, very serious effort with our state partners and also at the federal level, frankly, in our county, to bring them to the table and adjust the support that they began with us in, when they negotiated the first legislation, which Karen Bass carried for us, called 2599, and that was in 2010. Sharon, if you can move the slides forward. This is one of my favorite slides because it just illustrates, I'm an old English major, so I'm all about words. And when I look at data, I have to find some visual way to condense it. And I spoke about the emergency department. And I reminded you in the very beginning of that moment of me standing with Dr. Casillas in a completely empty emergency waiting room and saying, they will come. Here's what happens when they do. We get paid $250 for a Medi-Cal visit. We get paid $2,000 if it's a commercial visit for exactly the same service. We lost $56 million last year on our emergency department. That's a tough thing to make up with just reserves and marginal operating increases. So if you could forward to the next slide, Sharon, we're almost through here. We've got some funding priorities. Here's what we're doing to help relieve that pressure to, as we call it, decompress. We have quite a number of mental health patients who do come into the emergency department. As Elaine likes to say, we didn't mean to be a psychiatric hospital. We didn't mean to offer psychiatric services, but we had to because those are the patients who came to us. About 10% come with behavioral health problems. The ED is not a good environment for them. It's not a therapeutic environment. It's an environment in which their condition is likely to escalate, and it does not have the specialists that are there just to treat their type of condition. So we have carved out some space in the medical office building, the MOB, to create this kind of unit, which there's about 12 of them on the East Coast, and the data coming out for success is remarkable. So it has been tested, and we'll begin building that unit in January with the hope that we will open it this summer. And it means that we will take these patients to a therapeutic environment in which there are specialists there to treat their conditions. They will be released more than likely in less than 24 hours, more than likely back to home. If they were left in the ED, the data for these patients are that they are what we call on hold for 3 days and often more, until another bed is found for them, often in a psychiatric hospital. They become agitated. They don't have the right specialist around them. And as I mentioned, they don't go back home. They have to go to a psychiatric hospital. This takes care of that. We are still raising money for this project, but I'm very proud of the way that we have always done our work at MLK, and that is that we'll see a need and we say, we have to do this, let's go, and we'll fundraise behind it. We've been applying for public funding in the capital area too. I'm pretty confident that we will get there, but that's a risk we take, and it's a risk we take on behalf of the community. We're going to expand our emergency department, you can see here, with some more beds, and that will help enormously in the crowding that we have in our 29-bed space right there. So that's a total of 36 million that we're raising money for. And we believe we might get some help from the county on that as well. Sharon, if you could move forward. We see here's programs. I just wanted to give you a taste of the range of programs that the foundation raises money for. That's a big one at the top, 66 million. And it's not pie in the sky. We have a particular donor who has experience with us that we are in late stages of conversation with. So fingers crossed on that one. We've already raised 2 million for diabetes care, and we're on our way to raising more. Actually, we've raised like 2.7, and we have another 800 to go. Maternity, always a need there, and we're very ambitious with our maternity program. We launched a prenatal program, our first, in June, because we wanted the mothers who come to deliver to us to already have had care before they come. We're adding 2 midwives. We're looking for money right now for the contracts for those 2 midwives. Sharon, if you could move forward. Behavioral health, I already mentioned. We really need a bilingual psychologist. Sadly, for me, the waiting list for a new appointment is 6 months. Now, nobody in crisis can wait or should have to wait that long. So we do have a good partnership with an organization, acronym SCCC. It's Southern California Counseling Center, and they are fabulous partners. And they can take an appointment from us. They can usually turn it around in about 2 weeks. So the help that they give us, getting that patient into some kind of outpatient work before that patient can transition back to us for more treatment, is really, really valuable. We rely on our community partners a lot for that kind of work. And then GME, it's like, yeah, 1 million today. If we raise 5 million, it'd be even better, because those residents that come through, they're doctors, and we do pay them salaries. And if one of them is deciding whether to come to us or to Torrance Memorial in South Bay, the federal government subsidizes the Torrance Memorial salary at $135,000. The federal government subsidizes our salary for the same residency at $65,000. So we have to raise the money to make up that gap, to help that resident make the decision to come to us, a resident already burdened with medical education debt. And that's something, that's a formula that's controlled at an agency called CMS, Center for Medicaid Medicare Services. That's what we're working at the federal level with. Can you change that formula that was set up in the 1960s to favor communities like ours more? Sharon, I don't know if we have another slide beyond this. This is just our closing slide for ways to support. You're already doing the first. You're learning more about us, and you're probably sitting there thinking about what networks you can engage. We're always open to one-on-one conversations about different areas that you or any of your networks might be interested in. And then we will be calling on you to use your voice to advocate for our community. Not quite yet. And I will say that our strategy for addressing our financial situation involved the visit from Secretary Becerra. What did we ask him to do? We asked Secretary Becerra to call Governor Newsom and tell him what a valuable asset we have in this community, and to lean on Governor Newsom and the Secretary of Health in California, Mark Galley, and his Department of California Health Services to provide us with the additional funding that we need to make us whole. So the second part of that strategy is a one-on-one meeting that Dr. Batchelor had 2 weeks ago with the California Secretary of Health. It's meetings that we have coming up over the next few weeks with the heads of the Department of Healthcare Services, Michelle Bass. And finally, with the county, we had a very productive meeting that our Supervisor Mitchell chaired. She's such a wonderful champion for us, and I'm just smiling thinking of her posture and her energy in the room. We were asked to give a presentation to the county CEO, who is surrounded by her team, and Supervisor Mitchell led off. It was a really successful meeting, I would say. The county CEO, very fair, asking very good questions. So we are confident that we will get what we're requesting from the county in this fiscal year, if not within this calendar year. What we're requesting from the county is this. When we were set up, there was a funding agreement set up from the county. And that funding agreement provides us, we have a $375 million budget, provides us with a flat $100 million a year for indigent care to provide for the patients the county would ordinarily provide for. Half of that comes from the county, the other half comes from the federal government. It's a transfer and a match. But it's a 40-year agreement, and there is no inflation rider in that agreement, no inflation adjuster. We established that agreement in 2014, just a little bit before we opened. We knew it was a problem. Supervisor Ridley Thomas knew it was a problem, but he asked us to sign off on it because otherwise, he said, I don't think I'll get the votes I need from the County Board of Supervisors to open this hospital. So we said, okay, let's go, we'll figure it out later. And over time, with inflation rising and no inflation adjuster, the value of that 100 million has decreased to about 80. And you can see where the lines cross. You know, it's not that hard to mentally do the math on it. But I think that encouragingly, I can tell you now that the county is going to very seriously consider this request, which is a financial request after all. An inflation adjuster is going to be, this year it would have been 3.7%. So it's not huge. It's not certainly not going to break the bank of the county budget, but nonetheless, it's important and it compounds over time. The county is also, I have to say, looking for other ways they might help us. So we're very encouraged by that. If the state does not give us an indication that they are willing to come forward and help us within the time frame we need, then we are going to be calling on our community. We're going to be asking for the voices of our community to influence the governor's office. Right now, we're working with a reporter from the Los Angeles Times for a news story. And we're working with the editorial board of the LA Times to follow that news story with an editorial. That's what the folks in Sacramento pay attention to. If we have those two links, if you will, as tools to use with our legislature, then they are also tools that our community and community advocates can use. So that sort of outlines the plan for how we hope to get there, and outlines, I hope, two things: the need itself, what we're facing, and the value of this place for South LA.
Couple of things that I want to illuminate. You know, there's a lot of information, but this is critical information. If this particular hospital did not have a residency program, we may not get any doctors in our community. And so I think that that's critical. What I see is that you've patterned your work based on the needs of that specific community, maternity care, psych care, and diabetes care. You know, the wound care. You're literally tailoring the services that are being offered there, but also too, with that, you've created some tentacles so that you're out in the community with these services. That folks don't necessarily have to just come to the hospital. They can actually access some of these services with the mobile unit and what have you. You guys, I know that this is a lot of information, but we have to keep helping Martin Luther King Community Hospital, because if we don't, who will? Who will? You know, this isn't today's show is not necessarily about rah sis boom ba, and it's not doom and gloom, because as you see, they've done an exceptional job keeping things, keeping their commitment. You know, this one of the things that we always talk about is the promises that are made in our urban communities and how they're never kept. And the reason why I have these guys come on here and provide us with these updates is because regardless of the struggle, they continue to keep their commitment to servicing that community, which is, you know, literally a 4-mile radius of where the hospital sits. That's where the patients come from. Are there any questions, any comments, any feedback that we can share, any encouragement we can provide? And certainly, if you know folks who are interested in the medical sector, who can actually support the foundation, don't hesitate, you know, to refer those individuals.
Robin, I don't want to be remiss. I do want to mention our dream show that is premiering January 12th, 2024. I'll put a link in the chat, but this is a platform for us to share stories about South LA and our colleagues and the patients that we serve at MLK. And that's something that you can tap into right now.
That's perfect. Thank you, Sharon. I forgot about that. Crystal.
Wow. What's the smallest donation?
The smallest ever received, or the smallest on average? I don't want to pick on anyone. So I would say that we learned during the pandemic that we have a range of supporters across the country. It was really amazing, actually. It happened first in our team meeting when our annual giving director was saying, we're seeing gifts come in from South Dakota, from Ohio, from Minnesota, Texas. We were found. We're very digitally active. We have a very strong digital presence. But I would say the range starts with those small gifts. Let me just say like $25 to just pick on an average, all the way up. And I will also commend our own staff. We have one of the most successful employee giving programs in the nation of all hospitals, successful in the level of participation. Our employees, and I personally sign every single acknowledgement letter for the nearly 700 gifts that we have. And I see not only the names, but I see the departments they work in. I see their titles. I see if they're in housekeeping. I see if this is a nurse who's giving $1,000 out of her payroll deduction all year. These are very moving things to me, and those gifts are all from our employees.
Incredible. You guys have been doing a fantastic job, and I commend you all. We definitely need to get the information out and the word out. Even as you can say, small donations add up to big donations. So
Mhm.
maybe we can also help. We can help as well. Um, the maternity ward. So, what is the What are the number of births that take place through your hospital?
Great question. On average, between 650, 700. They're beginning to increase. Some of you might have seen the LA Times feature on our maternity work over Labor Day. It was a Sunday of Labor Day weekend. And we actually started seeing more maternity patients come to us after that. We expect that we'll close this year around 750, but we have capacity for about 1,000. And I will say that recently we've had a couple of mothers, in one case, a couple who came to us who had been planning on delivering at Cedars, but they saw the article and they decided that we would be a much better place for them to give birth. In late August, we had a crew from CNN, their documentary crew, on site filming, and Abby Phillip, some of you might know who that, she's an anchor at CNN, is producing a national documentary on maternal health. And we were chosen to represent a hospital that is doing the kind of care that other hospitals should do to achieve birth equity. One of the things that the crew told us before they come in is we want to film a woman in labor. And I said, well, yeah, good luck. Good luck on getting it. I mean, I've been in labor myself. This is like lot. Do you want cameras in the room and perfect pictures? Plus, we all know CNN, you're like in labor, thinking about the audience of millions. But actually, we got 2 different mothers who agreed. So we had our choice.
Wow.
And the CNN the CNN doc will be released, we think around November, December. So we'll let you all know.
Mhm.
Awesome, awesome. And especially since that's a big issue for women of color, Black women especially, giving birth. We have probably the highest rate of deaths from giving birth because we're in other hospitals that think we don't feel pain like everybody else.
4
Four
times
times.
the level
Yeah.
of mortality, which is just awful.
Wow. Well, hopefully that CNN episode should be great for people to know if you're looking for that place that cares about you and not the color of your skin and the color of your baby. Um,
Well, I think the big reason we've been singled out, not only for our results, but the big reason is our model. We have a very unusual hospital model, and that is that it's led by midwives. It's a midwife physician collaboration. Of course, we have an OB, and the OB on the team is led by the midwife. She calls the shot. She knows when to call in the OB if there's a problem, if there's a risk. That's what physicians should be used for. And there's a whole team around the mother delivering, but led by the midwife. This is very unusual in hospitals. And speaking of Robin, thank you. The choices we make to address the needs of our community, we pay for this out of our operating budget. Why? Because midwives are not reimbursed, only doctors.
ah,
And
wow.
in
And so
a hospital setting, the health plans tell us, you choose, but we're only going to reimburse one, the doc.
wow.
So we pay for our midwives,
So
and we think it's worth it.
Diane, with something like that, one of the other things that what I ask you to do is, as these policy opportunities come up, as the votes come up, please make sure we have that information, because
I
think that's where the community briefing family can support the hospital.
Yeah, the Midwife Association in California, Paris, who I think Wendy is with us, and we were introduced to Paris by Wendy. They're very active in trying to address policy change for payment of midwives. Our birthing center partner, we have a strong partner in Kindred Space LA. I don't know if any of you know that one, but Kim Durden is, she was part of the visit with the secretary. Very active, all of them, in trying to change the reimbursement policies for midwives?
I have there are a number of friend of mine that are still in birthing years. They've used a lot of midwives. In fact, a majority of them use midwives, but they come to their home. And a friend of mine specifically, who has a large voice out there amongst her peers. When your video comes out, or when your segment, I would love to get it so I can share it with her. She really, all 4 of her children have been born that way, and at her home.
The basis of our partnership, Crystal, is that, and say Kindred Space LA, that's the intention of a mother who goes to a birthing center. But when problems arise, they have to have a very reliable partner and to bring that mother to a safe space for a safe delivery. And we are the chosen partner for them.
Awesome. So please make sure, Sharon, send information to us. I'd love to make sure I promote that in my network.
Okay.
I think it's very important, especially, as I said, since the birth rate and the death of Black mothers is so high. That information needs to be known, that you guys are doing that and providing that kind of care.
And, again, I want to thank you guys for the information that you provide. It's heavy information, but it's insightful information. And in Martin Luther King Hospital, Community Hospital was built to serve its community. And as we've seen from this presentation, that's exactly what they're doing. And again, I know we didn't get a lot of questions, we didn't have a lot of interaction, but this was good information that we needed, and we need to help spread the story, tell the story, and be mindful of who we're electing. Holly Mitchell was at the table with her. The senator has shown up. We need to press on Governor Newsom, to do the right thing about our hospital, because it is our hospital. And ladies, I want to thank you again for the work that you do and your personal commitment to the marketplace and into the community and raising money. And right, Sarah, we applaud you tremendously for what you do. And we are a partner. We're here to help, and we can get the information out. I do have to beg everybody's pardons. I do sit on another board, Careers in Sports, and Crystal didn't correct me. I was supposed to put my background up for community briefing, and I just picked the blue one, and it ends up being my Careers in Sports.
Oh, there you go.
Charge to my head and not my heart.
Robin, I do want to pick up on something that you talked to me about in the beginning, and that is physicians. I want to leave you with this idea, because it's too easy to have the wrong idea and stereotype. We talk about the gap, right? The gap, 1,500. It's not because doctors don't want to work in this community. I want you to know that.
Yeah.
We have found an in excess talented physicians who are coming to work for us. Stan Frencher, who was the chief resident at Yale, Dr. Ansel Phillips, who was Mayo Clinic. All they needed was a little bit of filling that gap so that they could earn enough to have to make a living in our community. That's why we work on policy to raise Medicaid levels. We have doctors who want to serve this community.
And did you guys hear what she said? Some other hospital can offer them 130, 150,000. MLK has 80-some thousand, right? So where are they gonna? They're chasing the money. They got student
and
loans.
we raise the money to fill in that gap.
Fill in the gap, and they have student loans. They have commitments that they have to make. And so again, these are just the kind of information we need when we're making decisions about who's going to represent us, and especially as we get ready for this vote thing that's coming up. So Stephen, again, thank you for being an exceptional behind the scenes kind of person. So who do we have coming up next week?
Okay, coming next week, we have Kevin Harbour, president of BizFed.
Okay.
Awesome.
Thank you. I want to say thank you and hello to all of our regulars. We really, really appreciate you guys dialing in and keeping us alive and spreading the word. And I'm looking forward to next week's show.
Yeah, and please share this. This show is streaming on Facebook, Recycling Black Dollars, as well as my Facebook and a number of other groups that are out there. So if you guys are friends with me on Facebook and Recycling Black Dollars, please share.
We
So that
are,
we,
and we're friends with Sarah too, the Black Business Association. I just want to
Yeah.
give a shout out to you, Sarah. Thanks so much.
Hi,
She's
Diane.
our community leaders group.
Hi,
Yes.
Diane. You are just phenomenal at all that you do and representing and working with the hospital. I just think that you're just amazing at it, because it's a lot of unpacking that you did right there, and it just shows the amount of work that needs to be done. And I just real quick, I just want to say, I heard the piece about the mental patients that come in, and it wasn't really a service that provided, but you took the time to craft out a program for them, and then also made it to be a successful one that you're seeing opportunities out of that. So I applaud for those kinds of things, because a lot of times they just get turned away and it just compounds upon itself. And I really was so happy to hear that. So just great work to the both of you guys, and to Dr. Batchelor and and I look forward to that report on the updating of that report there. So thank you so much.
awesome. Are you guys partnered with NAMI, the National Association for Minority Mental Health?
I don't think so, although Wendy might be more. I don't think so.
Yeah, they work in the community for mental health for Black people. So you might want to reach out to them.
Okay.
That might be a good.
And we will. The recommendations, the outcome. Thank you for bringing up unequal treatment. I know that Elaine's chapters are due in the end of November, so it'll probably be in the spring when that comes out. We'll be happy to share that with you.
Scott, please use this as a platform for outreach. We all are connected, not just here, but in many other on many other platforms as well, so that we can help however we can help. And definitely, guys, you saw you can donate as small amount as you want and as large as you want.
Thank you for that, Crystal. Yes. Yes. And watch the Dream Show.
Yes. And where will we find that? On your website?
KTLA, and it's on the website. Sharon put the link in, but if you go to the website under, well, it's in the hero banner too, Foundation Events. We got 80,000, an audience of 80,000 last January. So we've been building this. This will be our fourth one. The first we got 35,000, then it went to 60, then it went to 80. So we're continuing to build our audience. KTLA is run primetime on Saturday evening of Dr. King's weekend.
Oh, okay. So the Dream Show.
Good.
Well, ladies, thank you so much for joining us today. We so appreciate all that you shared, and we definitely want to be able to assist in helping you get your word out and get the word about what's going on, and see if we can close in some of those gaps.
Part of it, we'll be celebrating together. Thank you, everybody.
Awesome.
Thank you.
Fantastic.
Thank you.
Bye.
Bye.
All right,
Bye,
everyone.
everybody.
It's 11:59. We want to thank you so much. And as Stephen said, our guest next week is Kevin Harbor. I just love Kevin Harbor and what they're doing over there. So please come back, tell a friend, tell all your friends to come join us at 11 a.m. or at the community briefing every Thursday morning.
Crystal, or
Yes.
Steve, can we get the flyer earlier in the week so that we can promote what's coming up on the community briefing? I typically get them Thursday morning.
Okay, all right. I'll
We'll have
send
it
them
like Tuesday, or, since we already know it's Kevin, maybe even tomorrow, so that we could promote it on our social media. And,
Yeah, I just usually it's on the bottom, the person that's going to be on the next one, but I didn't get the notification until the day of who is our next one. So our next three there'll be postcards already there, and the event will be on Facebook. So yes, I can definitely do that.
And also look at the website. We're going to update it now. We're doing a better job of updating it on a weekly basis.
I don't know if I have the website. Is it the communitybriefing.com?
.com.
Okay, I'll go there.
It also can make a donation when you're on that page too.
I bet I can.
So I will,
That's good to know, Stephen. Thank you.
but I will make sure, Joseph, that I do a better job of getting it out as well. I think Stephen sends it out and I send it out. Just my schedule's been a little wacky. Sarah,
And Renee, you can probably introduce the guest after Kevin, someone you know.
yeah,
You're on mute, Renee.
well, who is this? A cousin or a brother or who's Anthony Tabor? Renee, take yourself off mute. There you go.
He is my oldest brother's son, and
Oh,
he has a real estate syndication. I said, we've had so much discussion about investments and real estate and construction, and this is his business. And he is one of the co-founders and the president. He started the business. There are four of them, started it 3 years ago. They have 6 properties. Most of them are in the southern states because prices are better than there. They're also doing real estate development projects. They're having a big thing going on in Tuskegee that they're working on. And my father's a Tuskegee airman, so it's like kudos to the family. And he's just a whippersnapper. They're all highly invested in real estate in different ways, and they're young. And they, it's the general generational wealth that we talk about on this show.
Yes.
So,
Yes.
awesome.
especially her, Robin.
I love it. I love
So
Yeah.
it.
I am just over the top excited about it, and they are too. They have a great website. Haltere is their name. HALTERE.com. Halteregroup.com. And I just can't wait for them to be in front of us. So you can let your people know that they're coming. And I mean, they're looking for more investors. They're looking for creativity. They're looking for a lot of things. And they're, let me tell you this one thing. When they first started their business, they started naming the properties after their children. And so that was real cute. And some football or baseball guy bought the whole investment and named it, whatever his kid's name, but they've switched that. And so now they're Haltere in Atlanta or Haltere and that's all part of branding. So it's been an exciting.
All right, we're looking forward to meeting him. Awesome. Okay. All righty, guys. We're gonna.
Oh, let me say one last thing.
Yes, ma'am.
You all might have seen the note in the chat that I suggested we do something for Greg, just a community briefing gathering at his place. And Greg asked me, our Greg asked me if I would take this on for Dulans, would I head it up? And I said, yes, I volunteer to do it. Emma Maxey said, we got to have it at lunchtime so we can be out on the back patio and all of that. And
Okay.
Adrena offered to do some, graphics and everything. So I'll send something out too. I'll send it to you, Crystal.
All right, thank you.
And so we can do that. And he was tearful. He said, I had to read this twice to believe that you guys would do this. And so it was really, he's humble, it was
Now, when is he opening? I didn't get to see the
November the 6th.
Okay.
So it'll be sometime after that. I wish we could do a ribbon cutting and all that, but we're not doing that.
Well, I think I shared with you guys when he redid his renovations before. It was right when the Endeavor was coming down Crenshaw when he opened up. And the last RBD positive lunch dinner that we did it at the new conference room that he had built. And then the next day we all came and spent 12 hours in front of his store. He ran out of food, but that was the best grand opening anyone could have had. The whole entire neighborhood was sitting there waiting for hours for the Endeavor to come down Crenshaw. And so we had to eat. So where else did we eat? We ate at Greg's.
That
So-
is fabulous.
And I
Fabulous.
want to say that was in a November, whenever that took place. I think that was like 12 years ago. So that was in a November as well. So perfect, perfect. So thank you, Renee. We like that. All righty, guys, we are going to sign off. Thank you so much. And we will make sure, Joseph, we get that out to you early. I'll work on it this weekend. I think somebody asked for the YouTube video. That takes quite a while to get them all loaded up. So I think I'm too behind, but yeah, this one will be on there soon. All righty, guys.
Have a good week,
Bianca, happy
everybody.
birthday.
Happy birthday, Bianca.
Happy birthday, Bianca.
All righty. Bye-bye, guys.